you. Good morning, welcome. My name's June Haslam. I'm Fiona's mum, and Fiona's story is quite a long one before we get into adulthood, but I'll just quickly run through what she's been through, really, to get there. The journey started when she was age 8, and she was diagnosed with a craniopharyngioma, which some of you may know is a benign brain tumour. But her journey actually started years before that. And she had headaches, she had neck pain, she had onset nasal speech, which was unexplained, and she had a short stature. And it was only really that later on that they managed to scan her and find the craniopharyngioma. And then our journey started. We went to the Royal Marsden, and we had fractionated stereotactic radiotherapy in the year 2000. And it was with Professor Michael Brada. It was a pioneering treatment for brain tumours, and it was to try and avoid radiating the entire brain. It was actually very successful. It's minimally invasive, and she only had 4 little areas of hair loss in her head. And she actually, after 6 weeks of radiotherapy, she returned to school a week after it, and she was absolutely fine. Fortunately, it worked really well, and the tumour shrunk. And she was only left with hyperpituitarism, which we were expecting anyway, so she had to replacement of growth hormone, thyroxine, and cortisol. She was stable for about 5 years and did well at school, but unfortunately she started producing some cystic recurrences and with intracranial drains. I must actually point out this is Professor Brada, by the way, who's a wonderful man. And he presented his findings of the treatment because it was quite pioneering at the time. And he invited Fiona up to present with him and up at the Imperial College Cancer Research. And so obviously the press were there the days or whatever. So this is Fiona at age 8 having a radiotherapy. And then, so later on she did get some cystic recurrences and intracranial drains were inserted. At the age of 15, however, she had transfemoral surgery from an eminent neurosurgeon, Mr. Michael Powell, and we had that done at Great Ormond Street. It was very successful, and he managed to remove a large part of the tumour that was remaining. However, he did say it was very difficult because the tumour was very calcified with the radiotherapy. So there was a small amount was left. At that point, then, she had panhyperpituitarism, so we had to have diabetes insipidus as well. So she ended up with a water imbalance that she can't control now, and obviously that's to this day. And she had some visual field loss at this stage, but that was really all in terms of her vision at that point. And so we then went on to, we met Helen at that point, and at Great Ormond Street, and she became Fiona's paediatric endocrinologist from there on. And then subsequently went on to UCLH with Professor Balderwick into her adulthood as well. And it worked very well. She remained stable for a good 5 years again, and she managed to go to school, got her GCSEs, and she got 2 A-levels, and she started a primary teaching degree at Winchester University. But unfortunately, the bit that was remaining was still active and started to produce cysts again. So we were now back at the National and under Mr. Dorwood, and we had to have intracranial drains fitted. But unfortunately, Fiona had a setback, a second brain injury, if you like, in that during one of the procedures, she had a stroke. And she was trying to evacuate an intracranial hematoma at the time. She was left side paralysed, 10 days in ICU. And rehabilitation took quite some time. Her left side function has come back, although it still remains a little bit weak. And she's now registered disabled because she has moderate neurocognitive dysfunction. She has short-term memory loss. She has brain fog, fatigue, when she suffers badly from that to this day. She's also registered partially sighted now. And she has a very dense hemiopia, pardon me not saying that properly, and quite reduced visual fields. So the impact on her life became quite dramatic at that point, and she was unable to complete her university course. So moving forward quickly just to present day. Has that come up yet? No. Yep, present day. Fiona now suffers with hypothalamic obesity, and then that developed into type 2 diabetes mellitus, so sugar diabetes. She suffers badly with varicose veins, fatigue, and brain tiredness. And she normally has to rest sometime on a daily basis. Her endocrine care and diabetic care was moved to Salisbury because we live about 3 hours away, so it was much more convenient to do that. And our care really in adulthood is very fragmented. It's very difficult, and without people helping her, myself, family obviously helping her, to get through the medical system with all the different things that happen, I'm not sure how someone could do this on their own. So we met a gynecologist at that point, Annie Hawkins, who's a specialist menopause specialist. And she said that Fiona's estrogen and progesterone levels were drastically low for an adult woman, and were obviously contributing to some of her problems. So that's been changed, and she was not absorbing from the patches that she was given for many years, unbeknown to us. And she's actually just changed the delivery method, and she now uses a spray, and it seems to have actually improved quite a bit. And that was quite a shock to us, really, that she'd been living for that time with very, very low estrogen, very low progesterone, and anyone that has low estrogen knows how awful that makes you feel. And obviously the damage and bone mineral damage and whatever that could have been caused in that time. She has, unfortunately, a small cyst once again, which has actually remained stable for a few years, but it's being monitored. We're now under Mr. Dorwood at the National, and he monitors that annually for us, and he's quite happy with it at the moment. So hopefully that possibly is the end of the cyst growing. So I think really, moving forward with Fiona, I think that currently she needs the neurological damage that's been caused to her through craniopharyngioma and all its treatments and the actual stroke has left her with quite severe brain injuries, but she's still very much well and can do things. But she needs a more personalised programme. And in her last care, I think the most important thing that needs to be addressed is her sugar diabetes and hypothalamic obesity. And we're struggling to get help on the NHS to do such a thing. We obviously have the endocrinologist who helps us to give her all the medication and so on. But there was recently something in the south that was a diabetes to remission programme. And it looked absolutely tailor-made for Fiona. It was going to offer psychiatric, dietary and lifestyle care for a year. And it was more of a holistic diabetic care for her. And that's just what she needed. So we applied. But she was actually refused because she was a 6-year diagnosis criteria, so she was just outside that by a few months. So we appealed, the endocrinologist also appealed on her behalf, but unfortunately they just stuck to the logistic reasons that they couldn't actually accept her. But it's barriers like that that make it really difficult trying to treat it. And obviously we want Fiona to be independent, to be able to do this on her own, and she needs help to do these sort of things. So I'm now going to let Fiona have a quick chat about what life's like for her now and what sort of things that she would like to see happening.
Can you manage? Yeah.
Yeah. So currently I'm a golfer and I've played since 2015 and I'm now a 13 handicap. But I took it up in the first place to try and lose weight and gain a sort of social life. And I found it is the best sport for, hang on a minute, mental, physical, psychological and social well-being. Okay. I also play for EDGA, which is the European Disabled Golf Association, and in RNA, which is the Royal and Ancient competitions. And some of these have been at Woburn Golf Club and the London Club, which are quite prestigious golf clubs, if you don't know. But yeah, I'm now 13 handicap, but I do require, in the competitions mainly, because Mum plays with me otherwise, a sighter of my ball and a buggy because of my eyesight deficiency, which I can't see down here all the way sort of to the centre. I can sort of see there, but it's sort of pizza shapes out of my vision, which I can't see, and so therefore I can't see the ball. I can see the ball go, but then I can't. I sort of lose it and it's gone, and I don't know where it's gone. 4, don't know. So. Oh yeah, and so I'm planning to hold a golf day for charity, the Success Charity, and so I'm just wondering if anybody's interested or knows any celebrities or golfers that would like to take part. Then you can come and speak to me at the end and whatever. So. I also take a variety of medications, some of which are life-threatening. Again, hydrocortisone, thyroxine, desmopressin, various other ones. So.
Estrogen, you've got to remember that now.
Estrogen, progesterone, growth hormone, goodness knows what else. So, too many to remember, let's say that. So I carry a steroid pack in my handbag, and I wear my medical bracelet, both in case of emergencies when I'm out and about. There are some things that I find hard to cope with, though. Number 1, memory. My short-term memory is basically gone. Remembering yesterday, day before, remembering a couple of weeks ago, but my long-term memory is generally okay. So I forget things like appointments, events, sometimes even people that I've met in the past, and they sort of come, oh, hiya, and I'm like, hi, that sort of thing. I also find fatigue difficult to manage. It's quite overwhelming, the sort of amount of tiredness you feel. Let's say when I'm playing golf, it'll sort of just hit you, and you're out of it and confused and sort of dazed and whatever. So that's quite a challenge. So therefore, I have to try and plan my days, plan my medication, hydrocortisone basically, and factor in naps in the day, where I'll play golf, and then I'll come home and nap for a couple of hours, or I'll go and do something, and then I'll come back and nap for the rest of the day or whatever. So yeah, that's quite difficult to manage. My eyesight is a real deficit to me, and moving forward potentially. Yeah, I do often fall, trip, bump into things, just because I haven't seen them. And hang on. And my eyesight, doing my makeup, I thought I wasn't going to be able to do it again myself. But thankfully, my eyesight came back a bit after the stroke, and I managed to do it again. It's all exciting. Thank you! Also, my balance is quite bad. It's okay on the right-hand side, I'm all right there. Even that, I overbalance, but the left-hand side is just rubbish. So, yeah, that's quite a difficult thing to manage. But most importantly, the things that I have...
Next slide.
Oh, yeah.
Last slide.
Yeah, the things that can make my life a bit better are, number 1, being independent, gaining some sort of independence. I love my mum, but I'd love to be able to do things and sort of be confident enough to be able to go and cope with different events. And secondly, my left-hand side weakness, which hopefully more work with the physio and more specialised sort of support and treatments will help that. Also to become fitter and lose weight with a personal trainer potentially. And my memory and emotional well-being. A neuropsychologist is who I could see for that. They could also help me with my hypothalamic obesity, as well as a dietitian and personal trainer to lose weight. So, also my money and financial future. I would need to see a financial advisor or an occupational therapist to give me some sort of lifelong support in terms of when Mum's not here and can't pay for me for the whatever she pays me for.
And Fiona, you've also told me you'd quite like to have a job.
We won't go there. I've rethought this question.
I think that is something we should help.
Yes. But yeah, part-time. It would have to be part-time. I say an easy job, but sort of, I'm quite good at talking.
Yes.
So, a talkative job or something like that. And but lastly, I'm mainly thankful that my tumour is not cancerous, and that I'm able to live a life. I'm able to build on my life and actually enjoy life. So, yeah, that's the end.